Welcome to 12 to Your Health. I'm Dr. Derek De Silva. Well, tomorrow is the first day of March, and it also marks the beginning of Colorectal Cancer Awareness Month. Colorectal cancer is considered the third most common form of cancer detected in men and women here in the U.S. Here to talk about detection, diagnosis, and treatment is Dr. Debra Goldstein. She's a gastroenterologist at St. Peter's University Hospital in New Brunswick. Welcome to the program.
Thank you.
What is colorectal cancer?
Colorectal cancer is the second leading cause of cancer death in this country, and it starts when a polyp, which is a precancer, starts to grow in the colon, and then when it gets large enough, it turns into colon cancer.
What do people need to look at? What are some of the symptoms of colorectal cancer?
Well, the symptoms of colorectal cancer may be blood in the stool, may be abdominal pain that does not go away, and that is different than one's usual symptoms, and sometimes losing weight for unclear reasons.
Is there one group that is more affected than others?
Actually, what is really very interesting is that men and women are almost equally affected, and this tends to be a disease that starts in the prime of life, most notably sometime around the age of 50. Of interest is the fact that African Americans tend to develop colon polyps and colon cancer at a slightly earlier age, and we urge those people to start being screened 5 years earlier than the rest of the population.
So screening, colonoscopy, is that what we need to do?
Yes.
What is
Yes.
there any? So right, that was 2 yeses exactly. I mean, it just makes sense. And tell me a little bit, going through a colonoscopy, what can people expect?
Well, colonoscopy is a very simple test, and at the same time, it's a test that that tends to be inappropriately dreaded by people. The part of the test that people are most afraid of is the bowel prep,
Right.
Which is unavoidable. The test itself takes about a half an hour to do. One is sedated so that you are sleeping and you don't feel anything, and then the test is over. If there's a polyp, we remove it, and that's how we prevent people from getting colon cancer.
So and then once you have the test, you know, one of the things that I do is I usually do the stool samples for blood in my own practice. Is that how accurate, how valid is that?
Well, a primary care physician, an internist, or a family practice doctor usually incorporates the stool cards,
Right.
that stool test, in an annual physical examination. Unfortunately, if something is there, it doesn't bleed all the time. And so if a test is positive, that's a useful test. It tends to be too sensitive, so a lot of times you pick up bleeding of things like hemorrhoids that are
Right.
not really colon cancer or colon polyps.
Well, thank you so much for joining us. Thank you for the great information, and keep up the great work.
Well, thank you so much.
My pleasure.